So this is our research and our project that is called Etiological Characterization of Chest Pain in Emergency Department Consultations at Clínica Primavera. So, which is our question? Our question is that from the 100% of the patients that goes to consultation or are admitted in the Clínica Primavera by a chest pain, what percentage of these patients corresponds to cardiac etiology? And why do we make this question to us? It's because first, there is a stigma that has been developing in the medical practice around the chest pains. It's just like an early diagnosis that is, it could be just something like the physician considers always in the most of the cases that the symptom is likely like a heart attack in the majority of cases. I mean, could be a chest pain, but we have the bad habit of considering um, early diagnosis that the this symptom is a chest pain etiology from cardiac etiology. But it has been demonstrated that the frequency of this cardiogenic chest pain, in the most of the cases, it isn't a cardiologic etiology. Could be a smaller percentage when we're talking about something cardiac. According to the World Health of Organization, the ischemic heart disease is leading the cause of death globally. And according to the data in Colombia, it's the first cause of death, taking 50,000 of deaths in 2023. So the introduction and conceptual framework for our work is that in Villavicencio, which is the statement of the problem in here, we have lack of reliable epidemiological data. I mean, we don't have something that is that could be that could assure the epidemiological statement of the cardiological chest pain disease. I mean, maybe it is there are information globally about the country, about the world, but there is no information specific from Villavicencio. So we have here this problem. First of all, the lack of the information, and second, the bad habit of the physicians to assume or to assure that the chest pain is cardiac origin early. Yeah, we early assure that is cardiological etiology. And then what are our objective? First, we have our general objective, that is to characterize the etiology of the chest pains. I mean, overall, the etiologies could be cardiac, it could be from lung etiology, it could be from muscle etiology, could be neurological. So the first objective is in general to characterize where this chest pain is coming from. In the in the emergency department of Primavera Clinic, our specific objectives are to determine the frequency, the prevalence, and the incidence of the chest pains that are from cardiogenic origins. Yeah, over the past year, over 2024 could be. And the second specific objective for us is to evaluate the healthcare staff knowledge about this epidemiology. I mean, all the physician staff, nursery staff, all the people that are working with us, how much knowledge they have about this frequency, this prevalence, this incidence of the cardiogenic chest pains that are from cardiological origin. So it could be something useful for the people that works every day in the emergency department. So this is our second specific objective.
I will now proceed to explain the materials and methods section of our research. Firstly, the research design in description and retrospective. Our objective is to analyze the medical records of patients you consult for chest pain in the emergency department of the Primavera Clinic during the last year. Moving on the methodological framework, we will adopt quantitative approach. This approach is based on the analysis of data obtained from medical records. We will use a data collection from the same, specifically For this study, this file will include variables such as pattern identification, which include that on age, sex, and race. The characteristics of chest pain will also be recorded, such as its location, intensity, type, irradiation, deherring factor, and relieving factor in addition to final diagnosis. The data collection procedure will begin with the records of authorization from the management of Clínica Primavera access the medical records. Una authorization is obtained. We will review the medical records of the selected patients and record the information in our the data collection from throughout this process, and the confidentiality of patient information will be gathered. Finally, regarding ethnical aspect, this study will be carried out in accordance with the ethnical principle of scientific research established in Declaration of Helsinki. Informed consent will be requested from patients or their legal representative to review their medical records, and confidentiality of their information be ensured all times. This includes the explanation of the materials and methods that we will use in our research.
So now I'm going to explain the process of the data collection. And for that, we need to understand the population and the sample. In the part of the population, it's all patients who attended the emergency service of the Clínica Primavera or in Villavicencio Meta with chest pain during the study from January 2023 to January 2024. And the sample, it's a simple random sample of the population will be selected considering a sufficient sample size to obtain adequate statistical precision. And in the next component, we need to understand what's the inclusion and exclusion criteria. For inclusion criteria, we have first of all patients who attended the emergency department of the Clínica Primavera with chest pain during the study period. Second, patients over 18 years of age. And third, patients with complete medical history available. And if we want to know what's the exclusion criteria, we can find, first of all, patients with chest trauma, patients with chest pain of psychogenic origin, and the last one, patients with incomplete records in the medical history. And finally, I want to make a simple question for the process in the data collection, and is how will the data be collected? And the data will be collected from review of the medical records of patients who meet the inclusion criteria. A data collection instrument designated specifically for the study will be used, which will include the following variables, like, first of all, demographic variables, and that include age, sex, and race, and clinical variables, and that include pathological history, cardiovascular risk factors, characteristics, of chest pain finding on physical examination and result of diagnostic test.
How will the data be connected? Data will be connected from review of the medical records of patients who meet the inclusion criteria and the data collection instruments designate specific college for the study will be used was will included the following variables: demographic variables, uh, age, sex, race, clinical variables, uh, pathological history, cardiovascular risk factor, characteristics of change pains, findings on physical examination, results of diagnostic tests. These variables were considered to identify the dermatitis factors of the priority of care in the REX classification of patients with checks points in the study.
Analysis plant. The project focused on investigating the actual frequency of cardiology chest pain in the emergency. The parts on the Primavera Clinic in Villavicencio Meta. During the last year, data will be collected from medical records to share accurate the etiology of these pains and to evaluate the knowledge of health personnel about acute coronary syndromes in the city. Static, Statistic calculation will be made to determine the measures of central tendency, prevalence, incidence, and rate. They two not uses planned. They two calculated will be tabulated and analyzed using RS study. Statistical software frequencies percent to hit means and standard deviation will be calculated for now to tighted by Bulls statistical USOC. Action test will be performed to identify passive relationships between bulls. Diurnal assist plans aims to determine the frequency, prevalence, and incidence of cardiogenic chest pain and to assess health care persons now of acute coronary syndromes. Precises. Access to medical records from Clinica Primavera, Becker Dayton Cluration intro trained personnel for studies in night limitation. Availability IT and quality on meter patient bite in sample selection timing strength.
And what we expect in the results of this research. First of all, we expect to find a moderate frequency of the admission. We don't expect to find high frequency, but we neither expect to find a low frequency. We expect to find something moderate because it couldn't be something quotidian, but the cardiological origin of chest pain, it's just like in a moderate frequency. So we expect to find something in that terms. And we expect also to evaluate this knowledge of the staff about the coronary syndromes, but most focused on epidemiology and must focus on the local epidemiology. And we also want to assess the mortality outcome. We are interested on the people that are admitted to the service and the people that are diagnosed with cardiological origin. How many of these people died? Yeah, and we expect that this mortality outcome is low. It has to be low because this bad habit that we comment at the end of the presentation, it could be a key factor. It could be good in this case because if we made an early diagnosis, but we are in the great or we are in the correct diagnosis, it could be better to decrease the mortality outcome because the time in these cases are very useful.